Assalamu alaikum friends. Today we will talk about the sulfonamides. Sulfonamide is one of the class of antibiotics, and sulfonamides are bacteriostatic agents. It means that sulfonamide stop the growth of bacteria. Uh, Sulfonamides are the first effective agents used in man clinically to treat the bacterial infections. This is the structure of sulfonamide. The chemical name of sulfonamide is the para-amino benzene sulfonamides. This is the amino group attached at the para position, and this is the benzene ring, and this is the sulfonamide group. This position is called ortho position. This is called meta position, and this is called para position. So how a sulfonamide stop the growth of bacteria? What is the mechanism of action of sulfonamides? So we know that bacteria need folic acids for the preparation of amino acids, RNA, DNA, and other proteins for the normal growth. So that folic acid come from a precursor molecule which is called the para-amino benzoic acid. This para-amino benzoic acid is converted into dihydrofolic acid with the help of an enzyme which is called folate synthetase enzyme. This folate synthetase enzyme convert the para-amino benzoic acid into dihydrofolic acid, and then the dihydrofolic acid is converted into tetrahydrofolic acid, and this tetrahydrofolic acid is the folic acid which is used by the bacteria for the normal growth. So how sulfonamide stop the bacterial growth? Sulfonamide actually inhibit the folate synthetase enzyme. When the folate synthetase enzyme is inhibited, so para-amino benzoic acid will be not converted into dihydrofolic acid, and at the end tetrahydrofolic acid will be not formed. So bacteria will not survive because folic acid is very much important for the normal growth of bacteria. Sulfonamides are not effective in the presence of pus. Suppose a person has infection and the infection contain pus, so if we use sulfonamides, so it will be ineffective because pus contain high amount of folic acid, and bacteria can use that folic acid. So classification of the sulfonamides: one is the systemic acting agents. So it include the short acting, which is the sulfadiazine. Sulfadiazine duration of action is 4 to 8 hours, and we have intermediate acting sulfonamide agents, in which we have the sulfamethoxazole. The duration of action of the sulfamethoxazole is the 8 to 12 hours. We also have long acting sulfonamides, mm, in which we have sulfadoxine. The duration of action of sulfadoxine is more than 7 days. We also have some local acting sulfonamides, in which we have the sulfacetamide, which is mostly available in the eye drops form. We also have the silver sulfadiazine, available with the brand name Silvate cream, which is mostly used during burns. And we also have the mepenide. These three agents are used locally, topically. In the others, we have sulfasalazine, which is used both locally and systemically. Uh, it is also used in the treatment of IBS. It is the inflammatory bowel syndrome, in which there is the inflammation of the mucus layer of the intestines, and there is less absorption of the food, and there is frequent diarrhea. So we can use salazine 0.2 milligram tablet, which contain the sulfasalazine. So how it treat the IBS? Sulfasalazine inside the intestine converted into sulfapyridine and 5-amino salicylate, and these agents are used as anti-inflammatory, so it reduces the inflammatory condition during the IBS, inflammatory bowel syndrome. Pharmacokinetics of the sulfonamide. So pharmacokinetic means what the body does with the drug. So when we take a drug, so what will happen to that drug inside the body? These are studied in the pharmacokinetics. So the systemic sulfonamides are well absorbed when take orally, and they reach to all tissues, even they reach to the cerebrospinal fluid. Sulfonamide can cross the placental barrier, so it should be avoided in the pregnancy. It can also eliminated or excreted in the breast milk, so it should be avoided in the breastfeeding mother, because in the milk the sulfonamide will reach to the infants, and it can cause a various side effect in the infants. So what are the adverse drug reaction of the sulfonamide? The first one is hypersensitivity. Uh, some people are hypersensitive to sulfa drugs like sulfonamide. So when they take sulfonamide drugs, to their body show an exaggerated response to that drug. They include the skin rashes, itching, and exfoliative dermatitis. In the exfoliative dermatitis, there is the overall inflammation of the skin. And the second adverse drug reaction of the sulfonamide is the Steven-Johnson syndrome, which is a severe type of the hypersensitivity. And during Steven-Johnson syndrome, there is fever, there is blisters or ulceration of the mucous membrane, and also skin. Sulfonamide also cause the hemolytic anemia. Sulfonamide also cause the kernicterus. In the kernicterus, there is the displacement of bilirubin from the plasma. Sulfonamide cause the displacement of the bilirubin from the plasma, so the bilirubin become free, and that free bilirubin reach to the brain, and in the brain it cause the loss of hearing, loss of sight, and also cause the disability. Actually, kernicterus is mostly occur in the small age kids. So that's why sulfonamide should be avoid in the breastfeeding moms, because it will reach to the infants in the milk and may cause the kernicterus.